everybody. We have this wonderful opportunity to talk with Brian Tollefson. That would be Dr. Tollefson to you. I wanted to take an opportunity to talk with him today. He is our musculoskeletal expert. He does our musculoskeletal course, review course here at ESP. But one thing that you might not know about him is that he also serves our country. So Brian, which branch of the military are you in?
Currently I'm in the Air National Guard. Started out in the Army and then did a stint on active duty in the Air Force, and I'm in the Air National Guard.
Air Guard. Which state is?
Yeah, I'm in Mississippi.
Mississippi. So what does that entail?
Right now I'm in a position called the State Air Surgeon, so I'm over the medical assets in the state. When I was on active duty, I deployed a number of times. I'm actually going on an deployment in about 2 weeks over to Guam.
You fit that in while being a physician as well. You're in an emergency room physician as well.
Yeah, I work full-time at the University of Mississippi in Jackson, and I split my time between emergency medicine and sports medicine.
Oh wow, that's very cool. So you're going to Guam in 2 weeks?
Well, I'll be going with a air refueling unit, so I'll be the flight surgeon for that unit.
So are you like airborne? Like have you jumped out of planes too?
I did that when I was in the Army, but no, now I'm a medical asset, so they don't let
you jump because they want you to fix everybody else that's broken.
They got to keep someone healthy.
What made you want to serve our country and continue to serve, really?
It was just always a calling for me. Right out of high school, I joined the Army. I spent 4 years in active duty, then got out, went to college, went to medical school on the Air Force scholarship, and then served active duty after that. And then got out and joined the Guard. And I've just hit my 20-year mark in the Guard, so I couldn't get out, but I'm having a lot of fun.
Well, first, we love what you do with ESP. Obviously, you're an expert in your field, and I know anybody that's taken the musculoskeletal courses, they always give you the highest reviews. But then I think what's extraordinary, what really sets you apart, is that you continue to serve our country. It's people that are exactly like you that make all the difference for civilians like myself. We really appreciate it.
Oh, thank you.
For sure. I love the idea that you have so much fun doing it because, I mean, do you feel that that's true, that if you are doing something fun, then you're not working? Is that why?
Oh yeah, I don't think most people that are in the Guard especially do it for monetary reasons. They want to be there.
So just to help people understand exactly what you do or some of the things that you've done, can you share with us any, or is it top secret, or can you share with us like a mission that you did?
Yeah, and it's interesting, when I got out of medical school and went on active duty, it was right after 9/11 happened. So it was 2001, 9/11. The Twin Towers were coming down, and that's when I basically went to my first unit. So within 6 weeks of arriving to my unit, I was deployed overseas. So I spent time, basically my mission for the first 6 months I was in there was bringing detainees over to Gitmo. So we would go on these long flights from Afghanistan through Turkey and then to Cuba.
Oh wow.
And transported all of the combatant detainees that we picked up over there over to Gitmo.
Oh really?
So that was interesting. It was a lot of fun. I got to see a lot of different places.
I imagine it's really cool to see all those different parts of the world. And do you feel so proud that you're in the United States, serving the United States? I mean, as you go across all these countries and borders, and do you get a sense of, I'm an American?
To me, it's just a lot of fun to be doing that stuff.
Yeah.
And the people that you work with, it's just a different kind of person that's out there doing that, and it's a lot of fun to be around them.
How many people, are there other surgeons in your unit? Are you like the only physician assigned to your unit? How does that work?
Well, currently in the Guard, we have 2 medical units groups in the States. We have 2 separate bases. And there's several flight surgeons on each base.
Oh, okay.
And then I serve in the headquarters now. I kind of moved up through the ranks, and as a state air surgeon, I'm in more of an administrative role, and just kind of overseeing the medical assets.
So have you ever gotten to blend all your skills? I mean, I know as an emergency room physician, you're obviously going to be handling things like that in the military. But what about your ultrasound skills?
Actually, I did. When I first got off active duty to finish my residency in emergency medicine, it wasn't, maybe a month into residency when Hurricane Katrina hit the Gulf Coast. And I was in a unit in Mississippi, so we got activated and went down to the coast, set up a field hospital. And in our equipment in the hospital, we had portable ultrasound units. So,
Oh, really? See, this is like the blend of
yeah.
all your expertise. Did they know that you were an expert with ultrasound as well?
Well, at that point, I wouldn't say I was an expert because I just started my emergency medicine residency, so it was kind of learning on the fly.
Oh, okay.
I had some experience with it, but that was kind of all we had to evaluate these patients, and we were getting a lot of sick patients coming in that were displaced from the storms. So we got to use that, pregnant patients and cardiac patients. So it was interesting.
Trial by fire.
That's right.
The best way to learn.